Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Welcome to part 2 of diagnosing mental health conditions in people with intellectual and developmental disabilities. You know, I mentioned in the first part that it can be a real challenge to know what someone is feeling on the inside when they have difficulty communicating those things verbally. But there are some signs that you can look for that might point to a mental health condition. I do want to give the warning again that you must always rule out underlying medical conditions, other underlying causes of pain, underlying environmental conditions that could be causing adverse behaviors before jumping to a mental health condition. But let's go over a few other things that could point towards a mental health condition. If the person is having excessive mood or really unusual mood patterns that just don't seem to follow normal type mood patterns or normal responses to things, that might point a little bit more towards a mental health condition. If the person has a change in their appearance, let's say they normally are well groomed, they normally take care of themselves well and are like the way they dress, for instance, or dress in particular ways, and then all of a sudden these things change and they don't care about them as much. They're not as interested in their appearance in the same way that they used to be. That could point a little bit more towards a mental health condition. If a person has changes in their sleep, we talked about this before, but remember, if they have changes in their sleep patterns, sometimes those can point to mental health conditions. They might indicate underlying medical condition like reflux that keeps the person from sleeping or something like that, but consider that as well. If a person starts to engage in purposeful self-harm behavior, cutting themselves, hitting themselves, scratching themselves, pulling out their hair, that could lean a little bit more towards a mental health condition. Now, we talk about hallucinations and other psychotic symptoms, either hearing things that aren't there, seeing things that aren't there. Again, if a person can't tell you those things, it can be a real challenge to know what's actually happening. But one of the clues that we might see is that a person might respond to, say, something that's in the corner, and they might maybe strike out or get agitated or make noises at something that's not there. And they do this repeatedly. This might indicate that they're either hearing voices or seeing something that's not there, and they're responding to those things. So that might point you a little bit more towards, some sort of psychotic mental health type condition. If we see changes in eating patterns, again, people who are depressed tend to eat less or sometimes eat a lot more. But again, I have to caution you to rule out medical causes because they're much more prevalent when it comes to eating patterns. If a person has a history of a mental health condition that has been in remission, and sometimes a person can be in remission for many years, and then all of a sudden some stressor happens and these mental health symptoms come along again. But if we know that person has a history of mental health problems, then that could make it more likely that they might be experiencing a mental health condition as well. So it can be very challenging to diagnose mental health conditions, but it's really important that we do, because we don't want to put people on medications that aren't needed, or that are the wrong medications for a certain condition. And we don't want to just treat behaviors, just knee-jerk put people on medications to treat adverse behaviors without really doing a thorough evaluation of what might be going on. So thanks for joining me in this talk about mental health conditions in people with intellectual and developmental disabilities, and I'll look to see you next time.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com, go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in No Time, kind of as a compliment to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek mini. So thank you for watching. We'll see you next week.